Welcome. Thank you for joining us for the Understanding the Basics of Evaluation webinar for the Collaborative Research Center for American Indian Health, also known as CRCAIH. My name is Emily Whitehat, and I am the project evaluator for CRCAIH. I want to thank you all for joining us today. Currently, we have everyone on mute lecture mode. We will be answering questions at the end of the presentation. We will not be unmuting the lines, so if you have a question, please feel free to type questions into the text box during the webinar, and we will answer them at the end. I'm going to have my colleague here, Danielle, introduce herself.
Thanks, Emily. My name is Danielle Kenyon, and I'm also with CRCAIH, and I help our PI, Dr. Amy Elliott, with administration of the grant. And as a part of admin, I also help support Emily in our evaluation efforts.
This webinar will be recorded for future uses. The slides will be available as well as the recording on our website if you would like to reference it at the end. The goal of this presentation is to provide you with an understanding of the basics of evaluation and how we have operationalized these concepts within our Collaborative Research Center for American Indian Health. This presentation is intended to provide a broad overview. We're happy to discuss further detailed, tailored training for tribal partners and smaller groups. To start, let's briefly touch on what evaluation is. The Webster Dictionary defines evaluation the following way: to judge the value or condition of someone or something in a careful and thoughtful way. Over the next hour, we will cover the following objectives. We will provide a background of CRCAIH, explain why evaluation is important, identify types of evaluation, and the elements of an evaluation plan. We'll use a logic model as an example, and we'll learn the benefits and uses of evaluation outcomes. We will start with a brief introduction to CRCAIH. CRCAIH is designed to create a platform to bring together tribal communities and health researchers from multiple disciplines to work together in the development of cutting-edge transdisciplinary research that will address the significant health disparities experienced by American Indians in South Dakota, North Dakota, and Minnesota. In an effort to develop a robust transdisciplinary collaborative center, we decided that internal evaluation of our project would be a key component to continuously assess our progress and make improvements when needed, and to also recognize when we were on a good track with our work. We will provide an overview of our evaluation throughout the presentation. For example, communication is a big component of our work at CRCAIH. CRCAIH has a lot of moving parts. Evaluation helps us identify how we continuously improve the communication and accomplish the goal of developing a communication structure and processes to promote cross-communication among our partners. To fully understand CRCAIH and what it means to be a transdisciplinary collaborative center, we will review overarching themes of our center. The first theme is building research capacity. We currently have 4 tribal partners and are in the process of developing a partnership with a 5th tribal partner this summer. We provide core services in the areas of regulatory knowledge, methodology, culture, science, and bioethics, and community engagement to our tribal partners who are working towards developing and maintaining their existing research infrastructure. The next theme is to conduct cutting-edge transdisciplinary research. We currently have 3 funded 5-year research projects that are part of CRCAIH, 5 pilot studies finishing their first year, and we will be awarding 5 new year-long pilot studies in the next few months. Another theme is social determinants of health, a scope that all of our projects focus on. Social determinants of health encompasses social, behavioral, cultural, and our environmental risk and protective factors that influence health across the lifespan, and the interplay between these factors and the wider forces of economics, regional social policies, and procedures. The next theme is policy change in the region. Through research capacity building and transdisciplinary research, CRCAIH has an opportunity to affect policy change in our region. The final theme we will cover today is bridging the gap. Our goal at CRCAIH is to bring together tribal partners, researchers, Academic institutions and health entities who are currently conducting research are working in areas to improve health in our region. These overarching themes inform our evaluation process by providing context to our work and the bigger goal of what we are trying to accomplish. In the next few slides, we will share ideas of why evaluation is important for program improvement, delivery of services, and decision making. Evaluation can play a big role in how programs are shaped and can lead to program improvement, accountability, knowledge generation, unexpected outcomes, program value, can be a benefit to our target population, provide us help in decision making, and allow us to look at sustainability. Questions we may ask ourselves to understand the list shown on the screen are: has value been added? What story do you want to tell? Was this worth the investment? Should and how can our work be sustained? And as always, asking partners we do our work with, what kind of data do you want to collect to answer or demonstrate the value or worth of your program? This information could be used for future grants or for fundraising, for example. When considering the benefits of evaluation, it is vital to involve stakeholders and participants to gain all perspectives. In our work at CRCAIH, we strive to engage in good partnerships and provide services to our tribal communities. Therefore, community expectations of research are a central focus. This quote by CRCAIH provides a good insight to community expectations of research. We, as tribal people, want research and scholarship that preserves, maintains, and restores our traditional and cultural practices. We want to restore our homelands, revitalize our traditional religious practices, regain our health, and cultivate our economic, social, and governing systems. Our research and evaluation can help us maintain our sovereignty and preserve our nationhood. Another good message about evaluation by John Baer underscores the importance of evaluation. Measure what you value, and others will value what you measure. Evaluation of CRCAIH is important when determining are the community and our tribal partner needs being addressed. Another important aspect of evaluation and stakeholders are funders. Funders see the importance in evaluation to determine whether their investment helped to meet the intended outcomes. Was the program accountable with the funding provided? Programs will want to show funders that they were good stewards of the investment. We also want to include ourselves as stakeholders in the evaluation. The internal program team will look at evaluation findings as a way to share success with our partners and success of the center with funders and the community. Evaluation allows for continuous assessment of quality of services provided. We may ask, are we adding value to our partnership? As mentioned earlier, program impact and outcomes can be used for future funding, opportunities, and grants. Evaluator John Baer shares, for nonprofits, when it comes to evaluation, the challenge is figuring out what the organization values so dearly that it will track it in real time, so that staff can celebrate what's working well and make adjustments when things get off track. Finally, the last stakeholder we will cover today are the project leadership, who carry the responsibility of project success and completion. Evaluation can help inform the decisions made by leadership. The principal investigator, project director, or program manager will use the evaluation to determine if the project is meeting the short or long-term goals of the program. The evaluation will also provide an opportunity to look at the program accomplishments, challenges, and barriers, and allow for changes to be made in the program design and activities. The leadership may also use the evaluation to determine what impact the program has. Here we propose some evaluation questions that you can consider when engaging discussion around evaluation. What story do we want to tell? What are we most proud of? Does the program have worth or value? Are the services offered effective? Is the program innovative? And are we meeting the needs of our stakeholders? I really like this quote by John Baer that says, organizations should think about that moment down the road when a staff member will have to sit down at the computer and write a few lines about the work. As this is a focus of how I think about about the evaluation questions and the story that I want to tell about our center here at CRCAIH. Other questions that may be considered are, what information does the organization need to tell the story? How do we want to be a model? Baer also notes, organizations must figure out what information they must capture day by day so that one day it will be possible to pull that information from a sacred bundle. Evaluation data is the ultimate proof. The analogy of the sacred bundle is important when thinking about our work and gathering all the items we need for our bundle or our toolkit. Do organizations have in place mechanisms to track information over time? If so, staff will put the information they value most into their sacred bundle. It will be there when they need it. If the mechanisms are not in place, staff will at least have identified their priority for evaluation. An important element to remember is that questions must be reasonable and answerable. Now that we've provided a brief overview of CRCAIH and why evaluation is important, Danielle will focus on the different types of evaluation that programs can consider when exploring what will fit the needs of their program.
Great, thanks Emily. To begin discussion about the types of evaluation, it's important to first mention context. So understanding the role that context plays is critical to understanding the generalizability of the evaluation findings to other contexts, situations, and environments, as well as designing the right evaluation that fits best in your environment for your program. So the Kellogg Foundation references context as how the program functions within that economic, social, and political environment of its community, and addresses those questions that explore issues about the program relationships and the capacity. So often one of the first steps in program evaluation is conducting a needs assessment. And often you can do this by starting with is existing statistics. So if you wanted to do a project on type 1, 2 diabetes, figuring out what the prevalence rates are in your community, region, and how those compare to the US and across the world. Another option for needs assessment is doing a community readiness. If you wanted to do a suicide prevention program, assessing where that community is at in terms of being ready to propose and implement to action. Other qualitative data needs assessments are looking at doing focus groups or interviews with key stakeholders to get an idea of where they think the program can go and where there's gaps that need to be filled. Another good part of key stakeholder interviews is getting to know who else is working in the area. So if your topic is looking at youth prevention of homelessness, how can you work to collaborate together, and what are the overlapping resources, and again, looking how to fill those gaps. In terms of program capacity, and looking at how your evaluation and your program fits with who's working on the project, what the scope of work of your particular project is, and looking at how much can be done and how much of the work can be done in terms of designing and implementing your evaluation plan. In designing that evaluation plan, it's of course critical to look at the overall goals of the study to determine what types of data need to be collected, and looking at those long-term goals as well as the short-term goals, and what is the focus of what your data collection tools need to be. And of course, again, the final part of context is looking at that economic, social, and political environment of community. Again, looking for what is that broader support for the project? Is everybody all on board with the program, or are there gaps of knowledge that you need to do some education around your program that can help drive the questions of your evaluation? In the next few slides, we'll review the types of evaluation, and we'll use examples throughout that we've incorporated into our CRCAIH evaluation plan. So the different types of evaluation that we talk about today are program evaluation, process evaluation, sometimes referred to as formative evaluation, outcome evaluation, sometimes referred to as summative evaluation, developmental evaluation, and utilization-focused evaluation. So let's begin with Peter Rossi and colleagues' definition of program evaluation. which is the use of social research methods to systematically investigate the effectiveness of social intervention programs in ways that are adapted to their political and organizational environments and designed to inform social actions in ways that improve social conditions. So again, this is the overall umbrella term when you're looking at how to evaluate a program. Process evaluation is designed on looking at how a program operates or functions. So this type of evaluation doesn't necessarily focus and tell you about how if the tasks are accomplished or meeting the overall goals, but it helps inform how you can shape and help the program perform better. So the process evaluation is in terms of documenting who, what, where, when, and how the activities and the processes of your program function. It looks a lot at that implementation activities and how the work gets done and all of the details that go into meeting your goals. So a lot of it is looking at in terms of were the tasks conducted that you set forth and are those benchmarks being met and how they're being met. So a big part of process evaluation is that quality improvement piece and always trying to improve your program. And then finally, what are those changes that you can identify to improve the program and activity processes? The most popular type of evaluation that most people are thinking of when they think evaluation is this outcome or summative evaluation. And that's defined as looking at how a targeted group or social condition of the program is expected to impact. So what are those impacts that you're looking to make, and are you reaching your goals? So did you meet the goals that you intended and that you set forth? Did you find a change or an effect as a result of your program activities? So a few of the ways you can get at this that people look at in an outcome evaluation are user satisfaction surveys. Did people who went through a program or an education, did they have a change in knowledge, behavior, or attitudes? Did this project add value and significance to the topic that you're studying and looking at? And oftentimes this is where you can do a cost-benefit analysis to actually show, did your program make a difference? And were the funds used in a beneficial way? Another newer, dynamic, cutting-edge area of evaluation that we wanted to share with you today is developmental evaluation. And we really like it as we learn more and more about it because it really fits with what we've been conducting in our CRCA project because it fits the complexity and unique aspects of the center and allows for a continuous assessment and improvement to our services. So evaluator Michael Patton introduced this concept of a developmental evaluation a few years ago. He notes that it's relationship-based, it's adaptive and responsive. It can be this rapid assessment and providing feedback, so you're getting real-time results that you can apply in a very interactive design. Oftentimes, the evaluator is seen as part of the developmental team with the members to collaborate and conceptualize and design and test new approaches in long-term ongoing processes. So again, this is a lot of what Emily's role is with CRCA. She's embedded throughout the process and they're every step of the way with people who are actually conducting the activities. So again, the evaluator's primary function in the team is to infuse those team discussions with evaluative questions, thinking, and data, and really facilitate that systematic database reflection and decision-making in that developmental process. So again, the distinguishing characteristic of developmental evaluation is something that's being constantly developed. So it's not a static, what you would say, like evaluation plan, where you set it out and you say, we're going to measure this and we're going to measure it repeatedly every 6 months. The developmental evaluator is really co-creating that innovation through inquiry into how the processes are going and what are the consequences and impacts of those activities. So often it's the evaluator and the people involved in the program sitting together, generating those inquiry questions and establishing priorities for what to observe and track and figuring out what data to collect and how to apply those findings and interpreting those together. Drawing conclusions together about implications for next steps, and especially in real time, again, looking at adaptations in the face of the changing conditions and whatever is emerging. So it's really a great process to guide adaptation into this emergent and dynamic realities in complex environments. A part of developmental evaluation is to document the actions that those innovators and the program folks engage in, looking at the short-term results, the consequences of the action, and connecting all of the pieces to short-term and long-term vision. And then finally, the last evaluation that we wanted to focus on is this utilization-focused evaluation, which can be incorporated in the different types of evaluation. So in the formative, summative, process, or impact evaluation. And to learn more about this, we've included a checklist from Patton at the bottom of your screen, which will be posted later online. The utilization-focused evaluation is a little different because it's really judged on the usefulness to its intended users. So again, those program folks are maybe one of the specific audiences that Emily mentioned earlier. So you really want to focus on how do we get information back to our funders, or what is a piece of information that the PI really wants to hear about. This is when those users need to be clearly identified, and there's a strict commitment to focus on evaluation of maybe it's one specific piece, or there's one outcome that you're really interested in focusing on. So then the evaluation options are decided ahead of time, and then that analyzation and interpretation of findings to reach the conclusions are done right away, and disseminated the findings to your target population right away as well. So for example, in CRCA, one of the examples I can think of that we do this is for the pilot grants program. So we're very focused on specific questions when we have implemented surveys with our reviewers and our applicants. So such as, what would you like to change about the process? Is there a certain scoring system that you liked or didn't like? So now that we have 2 years of data that's specifically focused on these questions, we'll need to compare those changes and make those changes and do comparison of that data. And next, Emily will focus on different themes of evaluation.
Thanks, Danielle. Earlier we covered our overarching themes of CRCA, and now we will talk about themes of evaluation. To frame these themes, we will look at a CRCA-specific aim, building and facilitating capacity to perform research. To start, you will define short and long-term goals that we can measure for evidence of completion. For example, one of our ways to operationalize this aim is to look at developing research knowledge with our CRCA partners, as well as developing research infrastructure. So as we outline our evaluation, we outline our project, we're looking at how we're going to meet those short and long-term goals. We'll also reflect on success, areas of improvement, and activities. In order to meet these short and long-term goals, do we need trainings in specific areas? Have those trainings helped to facilitate those goals? We'll also ask, does the data we collect through our evaluation identify best practices that can be shared? For example, this area focusing on our research capacity building may be somewhat qualitative in that we may visit with our tribal partners and get their feedback on what were some of the challenges and what were some of the successes in getting a research code developed, how did that process work for them, and how can we identify those lessons learned to share with other tribal partners. Is it using community forums? Is it going to district meetings to share information? Another example of how we can collect data in another area of our project is to look at our pilot grants program, our summit. We conduct surveys on both of those. So how do we identify what was done well and can be best practices that can continue on or that we can share with other programs that are interested in doing something similar? We will look to see if what we wanted to happen happened. I know that sounds a little strange, but we will look at, did the ways that we wanted to achieve the goals that we set out actually happen in that way? Another question we'll want to answer and to look at is how do we continue this work for X number of years? I think as we engage in our work here at CRCA, one of our biggest issues that we lay out there is how do we facilitate and sustain the research capacity. And finally, how are we accountable? And how does accountability play into overall evaluation? Now that we've covered different types of evaluation, we will now discuss elements when designing an evaluation plan. While every plan will be different and developed to address the context of evaluation, we will want to familiarize you with components of the designs that have worked for us. The overview provides a brief introduction to the vision and intended outcomes. A specific aim section will outline the goals for the evaluation. The partnership and collaboration section will outline the roles and responsibilities. It may include sections like key personnel, qualifications, and roles, who's actually going to be doing the evaluation. It may have specific evaluation expectations outlined within the grant. So, for example, it may have specific data points that need to be collected that if this project, for example, CRCA is a part of a larger transdisciplinary funding mechanism, so it may have specific data points that pertain to that. It also may identify external evaluators. As Danielle mentioned, we have internal evaluation of our project, but we also will have an external evaluation done twice throughout this initial 5-year period. Evaluation functions. The evaluation functions provide the step-by-step methodology of how the evaluation will be conducted. Some processes may include developing a strategic plan or logic models, the use of smart sheets, development and use of surveys and qualitative interviews, may also include the compilation of existing data and reports that have been out there, as Danielle had mentioned earlier, may look at what needs assessments have been done. Are there dissemination activities? This section will also cover the anticipated barriers and corrective measures, because we all know that in any plan that we have, there will always be some sort of limitation that may be identified. That it's good to identify and to look at corrective measures of how we will address those limitations. The evaluation plan should be comprised of a series of measurements, and it must be accompanied by a plan to address those problems should they arise. Dissemination. The goal for dissemination of project findings should also be outlined. Will you disseminate in a format that will be for scholarly publications? Will it be for policy briefs? Are for best practices? And this is an important factor that we've looked at CRCA here, because we have several different partnerships, we have several different audiences, and so in outlining what we want to do, we will have scholarly publications that will be identified. We will look at the policy change in the region as our overall theme and how do we address that, and our best practices, like I mentioned earlier. And also always keeping in mind the broader community, the uniqueness of tribal nations, the uniqueness of our region here as well, and the wider scientific community. And finally, a timeline. It's important to develop a timeline with goals to assess the interactions and timely completion of the project. This timeline can be adapted through review of your success and barriers throughout the project, but it's important to identify at the beginning. Next, we will cover the logic model. While there are a variety of instruments used for evaluation, logic models are common, and often many grants will require you to have a logic model in your grant application. A quick Google search will provide several examples. In the next few slides, we will explore examples that we've provided here. There are also great resources available on how to build a logic model developed by the Kellogg Foundation and the Pell Institute, which citations we have at the end of this presentation. Essentially, a logic model will represent your planned work, our intended results. It'll provide a picture of how your program works and the theory and assumptions that underlie that program. In the next 2 slides, we will cover the different components. The objectives are goals, are specific aims of the grant or program you want to achieve. The resources and contributions, often referred to as inputs, will include resources needed to do the work of the program. This may include your collaborators, it may include your community partners, if they aren't already included as collaborators, and it'll also include your capital or your resources identified to accomplish the program. Outputs and activities are processes and services, are products that may result from the activities or strategies that have been developed or delivered. This may include classes taught, trainings offered, specific meetings held, or projects are products developed. Our outcomes will again outline our short and our long-term outcomes. So what is something as a short-term outcome that you would see maybe accomplishing in the first couple years of the program, if you have a 5-year grant, maybe the first 1 to 2 years, or the first even up to 4 years, and then your long-term outcomes really would get at your sustainability question. What do you want to have over time, and definitely through the duration of your grant or your project. And your impacts may result at the system or community, tribal or organizational level. They can result in capacity building, improved health, or access to care, for example. This slide shows the categories that we chose to use for CRCA and an example of categories provided by the Kellogg Foundation. Again, we've included the citations at the end if you want to look up those citations. The Kellogg model that we've provided here is from their program implementation template. It outlines the areas that we covered briefly in the slides, the resources, activities, outputs, short and long-term outcomes, and the impact. And there's a brief description here of what each, again, would cover. And finally, our CRCA evaluation logic model. So here we decided to arrange our models with different categories while also including some specific components that need to be in there. The CRCA logic model has our specific aim on the top that we're hoping to address, and the first line, this is just one section of the overall logic model. So the first section, the objectives, shows that we want to monitor the conduct and track the progress of the CRCA activities to provide the admin division with the data to assist with the planning and management of CRCA. So in order to operationalize this objective, we needed to first look at who are the resources and contributors that can help us accomplish this, who would be the responsible lead. So our evaluation team would be the overall leader in this, in bringing together the different teams. Our administrative division is very key to this, as well as the other CRCA cores and divisions. At CRCA, we also have an advisory committee, which is our executive steering committee, that we would also bring into these discussions. Next, we defined our outputs. What activities or strategies would help us accomplish this goal? So we looked at developing quarterly and annual reporting timelines. We have quarterly and annual reports that are due to us by our quarters, our divisions, our research projects, pilot grantees, and our tribal partners. Another area is to meet with tribal liaisons once a month. So once a month, our evaluation team checks in with our tribal partners to make sure that we're continuing to offer the services that we've intended to offer. And also meeting with our cores and divisions once a month. As part of the admin team, we have monthly meetings with the cores and divisions and looking at how we provide strategic planning and evaluation support services. Again, our short-term outcomes were that monthly evaluation updates would be a part of the admin meetings and would help us address any of those barriers that we may have, or challenges that we may have identified, but also what are the positive, good things that are happening. And the long-term outcomes are to allow our CRCA partners to be able to use our data and just our CRCA cores and divisions to also use that data to continually improve the quality of the services that we provide and in the research capacity building activities.
Great. Thanks, Emily. Next, I'll keep talking a little bit more about our CRCA evaluation metrics or indicators to express the application of the concepts we've outlined throughout this presentation. So we've touched on many of these topics, but two of the big ones are really documenting those key accomplishments as well as the challenges that came about when you were trying to meet those accomplishments. And then, of course, we're always looking at efficacy and the fidelity of the activity. So again, did you meet the goals that were set out to meet quarterly or monthly, and is that done in an efficient way with resources? Other metrics that we look at are the translational activities, so moving the research results and disseminating them back to the communities that we work with, as well as other stakeholders. Looking at that scope and the impact of the research results. Looking at the innovation of those projects and activities that have gone along with not only the cores and divisions, but our research projects. How do we always try to better improve our collaboration efforts and our communication efforts with internal to CRCA and all of the parts, as well as to our external partners? And how do we create better, more efficient collaborations to meet the needs and improve American Indian health in the region? And again, back to that final integration and synergy. How do we get all of those moving parts working in the right direction? So a lot of times these are really big concepts, and it's overwhelming to think about them at one time, but it's really good, and we found it really beneficial to bring up these big, broader concepts, not to get too focused on the day-to-day work, but really thinking and helping people think long-term. What is the long-term impact of our work going to be in 5 or 10 years down the road? So again, some examples and various elements of the qualitative and quantitative data collection that we use as part of our process evaluation. As Emily mentioned, some examples of our meeting notes. So documenting, we have several ongoing meetings with different groups, and those meetings are really good in that developmental evaluation process to get at and troubleshoot the different problems and challenges that come up, and discuss the different strategies and decisions that need to be made. For biweekly reports, we have action items that we track, and we also try to think about plans for the next quarter, the next year, as well as the next few years. So we have quarterly reports that help us plan ahead and think ahead for those goals, as well as our annual report for our funder. As Emily mentioned, we have monthly check-ins with the admin team, with the different cores and divisions, and with our tribal partners. So a good part of the process evaluation is documenting these steps of process and engagement. And one of the tools that we use are these capacity building assistance forms that we've found to help promote communication. When if we hear a request when we're in a meeting and it's not a request that we ourselves can fill, and it gets passed along to a different core and division in CRCA, we have a tracking process that we as the evaluation team can help facilitate the goals being moved along, and just keep following back and making sure that things are being followed up on. So when we really think about process evaluation, these data that we collect, and again, this is the process data, help us document all of the magic that went into the activity, so that we know that when the outcome evaluation comes and we've documented if we've reached our goals or not, or a certain percentage of people are tracked and helped, how these goals were met, it helps us step back and say how the goals were met, and really getting at that process and activity. So, for example, in our fiscal management process with our subcontracts, we documented through all of these process evaluation metrics. We saw a need for check-in and support, and implemented some of the processes with our tribal partners. So when evaluating your CRCA outcome evaluation plan, you might want to consider some of these various elements and questions. So when filling out those quarterly or annual reports that you often need to do for funders, how do you frame best what you're doing and capture what is really important and those big key successes? Another question to ask is, are we reaching the target population that we thought we were going to, and how do we set out, and are there gaps in reaching different segments of the population that we really thought could benefit from a certain knowledge or training? And then third, what products are useful outcomes? So how do we identify resources to develop and disseminate to get at the best practices that you're accomplishing in your program? And then finally, how do our meetings and all of the time spent in planning and how does that really translate to actions and outcomes? So again, the frequency of the results that you're publicizing and making sure that your materials reach the broadest scope possible, and how are you best reaching that target population? So how do our collaborative discussions result in actions? And of course, with any sort of project, as well as with evaluation, there are challenges that you may encounter. So evaluation is not an easy task when reviewing a program and suggesting improvements and changing. So you might picture a person with a clipboard checking off very satisfied, unsatisfied, but we really strive and find that evaluation is more of a collaborative process, and it found that transparency and open discussions with the broader team from the beginning of each process are key. So even in difficult conversations, it's good to remember that the evaluation team and the program team, that everybody has the same goal of improving the program and reaching your goals. So different other challenges that you may encounter are access to the program information and deliverables. So often this is most difficult when you're conducting an external evaluation, when it's not, the evaluators are not embedded in the program. So some of those factors aren't as known or aren't as readily available. Another challenge is that evaluation questions and methods may not be consistent with information that needs to be gathered. So for example, if an ongoing process of a project is collecting data, but may not have realized the importance of tracking participants with an ID number for long-term follow-up that evaluators may see a need for that may not already be within an established program. Another challenge is, of course, a lack of expertise or resources to conduct an evaluation. So evaluation takes a lot of forms and definitely takes a lot of time and attention. So you can understand a lot of times folks from programs feel they can't and don't want to divert resources away from programming because it does take a lot of effort. But again, we would say evaluations can be conducted in a small focus, maybe the utilization-focused way, or the broader, more integrated way. And we would argue, no matter what your evaluation needs, there's hopefully a long-term a benefit to conducting an evaluation, and a lot of times the benefits outweigh those costs. And then sometimes there is a challenge of a lack of follow-through on recommendations. So, of course, that's going to happen where in an ideal world everyone would agree on whether a recommendation could be implemented or not, but some recommendations may be harder to implement. So this happens especially if external evaluators don't know the program well enough to provide recommendations on implementation, and some good ideas that have been identified throughout the evaluation are just too difficult to implement, and those kinds of things definitely happen. But again, through open communication, hopefully those issues can be resolved.
Thank you, Danielle. Before we take questions, we will cover briefly our CRCA evaluation services. Here at CRCA, we have our internal evaluation, but we also have an evaluation services for our Center for Health Outcomes and Prevention Research. So I just wanted to briefly touch base on those evaluation services and to just give you some more steps in what we're able to assist with. And to think about just that overall, when you're thinking about the story that you want to tell, we're here to provide feedback on that, or just to visit with you more in depthly on how you would want to do that evaluation. So our process and outcomes evaluation, Danielle covered that throughout the presentation, looking at the tracking and the measurement metrics, what makes sense for your program, for your target population, and the program that you, the outcomes that you've identified, what measurements would make the most sense. Surveys, like I mentioned earlier, we do surveys with our pilot grants program, we do surveys with the trainings. You will all receive a survey with respect to this training as well. Impact assessments, you can also think about needs assessments, community readiness assessments. What assessments are important that will be part of this process and outcomes? And logic models, developing logic models that will help identify those short and long-term outcomes to meet your goals and specific aims. Strategic planning is another area, identifying the existing resources that you will need with your program to identify those long-term goals, to really think about sustainability. I think strategic planning plays well with looking at your long-term ideas and vision for your program, and what are the specific elements that you want to relay with that. And finally, reporting. As we mentioned, we do monthly reporting, monthly, quarterly, and our overall yearly reporting. And just looking at the lessons that we've learned over this last year about how to make sure that our reports are effective, that they really cover the highlights and the significance of our project, that they really show what we've done, and focus on those areas that our funders want to see, while at the same time really showing our success of our program and our center here overall. We want to thank you for taking the time to attend our webinar. We hope that this is a resource that you can use in the future for your planning, for your evaluation needs. If you're interested in future trainings on evaluation or have specific questions, you can always reach out to us at the email contacts above, as well as to our general CRCA information email and our CRCA website, our phone number. If you have questions for us now, please type them into the question box on your screen.
Great, thank you for those questions. I see some flying in. We're going to start with one. You've included some great citations in this presentation. What are your favorite resources in learning about how to conduct evaluation?
Thanks for your question, Danielle. There's several resources available on the web, but also some great books out there. As you see throughout the presentation, we've highlighted the Developmental Evaluation textbook by Dr. Michael Patton, which was really an extremely useful resource for not only outlining concepts as we've engaged developmental evaluation into our project, but also the specific examples that are shared on various projects to really look at the overall systems and complexity. Rossi and colleagues also, their evaluation textbook, A Systematic Approach, outlines more of some of the classical elements of evaluation that are commonly used. And the Kellogg Foundation just has a wealth of information and resources out there, from everything to your overall evaluation plan, but also to looking at specifically developing evaluation logic models. And again, I cited throughout the presentation John Baer's Evaluation in the Sacred Bundle, which was really something that helped me put together the whole part, just thinking about our CRCA project, how to really tell our story and get to the elements that are important in sharing that.
Great, thank you, Emily. I know there's been a couple of questions about getting the slides, and these slides will be posted to our CRCA.org website in the next couple of weeks. All right, here's another question. How do you deal with people when reporting and missing deadlines?
I think that was definitely an element that we left out of the slides that evaluators, the challenges that evaluators face, which is a very realistic challenge that we should have identified. But it's a good question. I think one of the important things is having discussions of what the importance is of the evaluation and how this all plays into the overall story, how it helps us identify those best practices. And sometimes as the project evaluator, you do have to just be very persistent and do continuous follow-up when needed.
Very good. Any other questions? Please feel free to type them in.
Thank you all again for attending our webinar today. Again, our contact information is here on the screen, but can also be found at www.CRCAIH.org. We look forward to any feedback that you have. As evaluators, we are also looking at ways that we can continuously improve our work that we do here at CRCAIH and just in general. So thank you again and have a great day.